Greetings. So I'm going to go ahead and jump right in today and try to keep this lesson relatively short. So I assigned you a passage from Sigmund Freud's Totem and Taboo, and we are now 3 weeks into our unit on mental health and combat trauma. And thus far, we've read an excerpt from the DSM on the PTSD diagnosis, as well as some of Didier Fasson's commentary on the history of the trauma construct. We've talked about how numerous social and political forces ultimately contributed to the PTSD diagnosis and the way that it was developed. Numerous interests had to be satisfied to get the diagnosis that we have into the DSM itself. Importantly, the disorder had to be framed as a biomedical disease, and this is something that was done primarily, and really to put this as simply as possible, framing PTSD as a disease made it harder to accuse people who suffer from trauma as being weak or failing to master the active mind over matter. If PTSD is framed as a disease, something like cancer, we can see it more as something that is not that person's fault, or our skeptical society will be more likely to provide people with resources that they need. It is a tool of managing audit. And like I've said before, that's not to say that the PTSD diagnosis isn't real, but it is framed in a way that serves that purpose. It's to negotiate, or at least partially designed to negotiate a set of audits that exist in our society. Yet in the 40 years that have passed since PTSD first showed up in the Diagnostic and Statistical Manual, it has become a kind of an extraordinary social reality that strongly influences the way that we relate to war as a society. It's almost impossible now to talk about war without talking about PTSD. Whatever a veteran's experiences are after war, especially as it regards to things like their struggles, or particularly struggles in integrating back into civilian society after war, those things all tend to be attributed to PTSD. Combat trauma and how it is experienced in this whole discourse of PTSD has a lot to do with the way that we understand war today. So for today in our reading this week, we are going to look at this from a little bit of a different angle. We're going to go back about 100 years. Sigmund Freud is somebody you've probably all heard of. He's best known for his theories of childhood and the belief that childhood experiences contribute to our experiences later in life, largely through internal conflicts that occur in our unconscious minds. And this is the basis of the theory of psychoanalysis, which, as we discussed a couple of weeks ago, has waned in influence since the late 20th century. This is something a bit different. I assigned you a large passage from Totem and Taboo, but I told you that you could just focus on part of it if you didn't have time to read the whole thing. It's okay if you didn't read the whole thing. I'll reference the greater work to try to put the section that I did have you read in context. So in Freud's day, mental health was thought of very differently than it is now. This was in an era before the age of the DSM and of psychiatric diagnosis, psychiatric diagnoses as we know them today. To put it very simply, mental health was seen as a thing that existed on kind of a binary. There were two kinds of people, sane people and insane people. And the category of insane would have included basically the entire range of what we now know as very diverse mental psychiatric diagnoses. Because most people at this time did not conceive of mental health struggles as being based on biomedical factors like is common today, it was generally believed that healing from mental illness was an exercise in rationality. You kind of had to train a person's brain to start working in rational ways again. That was the way that mental health was approached in this time. So, with regard to Freud, he was a reader of anthropology. He was very interested in anthropology and particularly the work of James George Frazer. Frazer was a prominent early anthropologist. In his day, he was considered to be one of the world's most prominent anthropologists. However, his work is not really regarded very highly today. He was kind of the archetype of what we talked about earlier this semester when we referred to armchair anthropologists. He wrote works of anthropology that were based on people that he had never visited, and they were based on correspondences that he had with missionaries and colonial agents who were operating in the territories of these peoples. And Freud was fascinated by the diversity of human behavior. And in particular, he was interested in a lot of what you might call the ceremonial or magical behaviors of people, things that were not seen as valid by Western science. From this, Freud developed a theory which is obviously not seen as credible today, and hasn't been for a very long time. But Freud's theory at this time, which he's trying to present in this book, this is sort of the greater context of the book. His theory is that the magical and spiritual beliefs of indigenous peoples, people who would have been called primitive at that time, were analogous to the thoughts and behaviors of insane people in Freud's own society. He based a lot of these theories and his argument on reading Frazer's anthropology. However, while Freud regarded Frazer pretty highly, he believed that Frazer was mistaken in how he accounted for a lot of these practices. Frazer attributed numerous behaviors to magical thinking. In other words, Frazer believed that people, for example, believed in ghosts because of magical thinking. He thought that people would just believe silly things because they were naive and they didn't know better, or they needed explanations for phenomena that they didn't understand. In that situation, they would just make things up, like they don't know what causes a volcano to erupt, so they have to invent gods who make this happen so it can make sense to them, or someone's apparently very healthy grandmother suddenly has a stroke and dies suddenly and unexpectedly. And these people don't know what a stroke is, so they have to make sense of it. So they decide that what happened was a curse, and that tribe across the river that they don't like must have put a curse on grandma, and that's why she died. It was witchcraft. This is what someone like Frazer is referring to when he refers to magical thinking. Freud, on the other hand, you might say that he gives these people a little bit more credit, and he assumes that these things are cultural manifestations of the very same sort of process, the same processes that he believed to be at work in the psyches of his own patients, people who were suffering from mental illnesses. He believed that there were numerous unconscious processes that were contributing to the practice of these behaviors that he and other Europeans saw as so irrational. It's important now to point out that this is important. If Freud saw indigenous peoples, non-Western peoples, as analogous to insane peoples, or insane people, who in the world do you think that Freud saw as analogous to people who are sane? White modern Europeans and Americans who participated in Europe influenced culture. That would be the kind of culture that is analogous to the sane person. If indigenous people are analogous to insane people, or Freud would have said primitive people were analogous to insane people, then modern white Europeans were seen by Freud as being analogous to sane people. So this is important when we talk about the portion of the reading that I had you focus on. So what was that? Freud was interested in the ritual treatment of enemies, the way that societies and their warriors treated their enemies, especially the enemy dead, especially their treatment by the people who killed them. He was interested in these kinds of rituals that surrounded the way that you're supposed to treat, the way that someone who killed an enemy was supposed to treat that person's body. And he observed a whole range of behaviors around these bodies that were the kinds of things that Fraser attributed to magical thinking. Freud starts out with the story of a people who lived in the Pacific, and these people would sever the heads of their slain enemies, and then they would bring these heads back and have elaborate ceremonial behaviors in which they would honor the head of their killed enemies. They would do these interesting things like putting food in their mouths, which Freud has to assure his readers that this was done as a sincere attempt to honor the person rather than to mock them, which might say something about Freud's reader base and the expectations that they had of how people are treated. Um, this kind of behavior looks very strange to someone who's a member of European or Europe-influenced North American society, and it kind of goes counter to the ways that we tend to think of enemies in these societies and the way that they're treated on the battlefield. This goes a little bit back to our first unit when we talked about the diversity of approaches to war. There was a regard for the enemy in this group of people that Freud expects to look alien to his European and American readers. However, this happens for a reason. This is where Freud presents his own theory that differs from the way that Fraser had framed these same ceremonies. Freud explains that these people are afraid of being haunted by ghosts. They don't want to be haunted by the ghost of their slain enemies. And Fraser, of course, attributed this to magical thinking, but Freud imagined that there was more going on here. Freud expected that this haunting was based on a real phenomena that had been experienced by these people. He believed that people went to war, killed enemies, and then came home and had these negative experiences that they attributed to ghosts, the ghosts of their killed enemies. And to prevent this from happening, they had to have these ceremonies and appease the spirits. So what does Freud hypothesize? This is where we see Freud make this huge leap from previous theories, and he posits that these negative experiences that people are having are rooted in guilt. Do remember here that Freud is the leading proponent of psychoanalytic theory. He's comparing cultures to individual psyches. He believes that people in his own society who are insane are such because of unconscious processes in their minds that are based on real experiences that they had had. This is in an era before the PTSD diagnosis existed. This is before the disease model of mental illness. So this is a very big leap. Freud is positing that the experience of killing at war causes guilt, and that this guilt can manifest as symptoms that people ultimately attribute to being haunted by ghosts. So this could be seen, I think it certainly can be seen as an early manifestation of combat trauma theory. So while we look at this and we see a pretty significant leap in how Freud is understanding this with respect to some of his predecessors, things like the credit that he's giving to these people and their psychological processes, we do also see the limitations of his own ethnocentric bias. But we have to extrapolate a little bit here to make total sense of that, putting it in context with the rest of the book. So if Freud is comparing the experience of haunting by these indigenous people to the model of insanity that he understood, which is what he's doing in this book, we can extrapolate from there that a more rational modern European soldier in Freud's mind should not be expected to experience guilt in this same kind of way. To be fair, as we're framing Freud here, Freud was in practice, he was an early defender of many of the World War I veterans that we talked about earlier this semester, who were, originally thought of as being shell shocked and then later kind of dismissed as weaklings and not being cared for properly. Freud acted as an expert witness in court cases about this, trying to get resources for these people who needed help. He did care about these people. However, he still saw what was happening as a mental illness that could be defeated through rationality. Freud never comes out to ultimately very clearly say here explicitly that properly rational soldiers should not experience complicated feelings and guilt after war, but in the context of what he's saying in the total book and how he's mobilizing um, these these experiences by these indigenous people, it is strongly implied. So later in this same text, we see Freud doing a direct comparison between American soldiers and some of their Native American allies in combat with other tribes during the Indian Wars. The interesting thing that he points out is that sometimes these Native American allies demonstrated extraordinary prowess in battle. They were very competent warriors and they could defeat their enemies in combat. However, they were ultimately seen from a structural perspective as poor allies to the United States Army. Why is that? It's because they had to observe so many ritual purification rites every time they killed someone. As soon as they would kill somebody on the battlefield, immediately they were obligated to a whole list of prohibitions and ceremonial purification acts. And these things, depending on the tribe, tended to render them non-combatant for a period of time. Sometimes this period would last for weeks, sometimes for months. And in short, the ritual behavior that they observed um, prevented them fundamentally from being able to kill with the efficiency and volume of the United States Army. An American soldier is expected, as a rational modern man in this time, to go to the battlefield, kill as many people as he possibly can, and then return home to his civilian life completely unbothered by that experience. Um, this difference has tremendous implications. When I say difference, I mean the difference between this these approaches to battle. People like Freud, citing Fraser referenced the Pima people. The difference between, for example, these peoples and the American soldiers that they were fighting alongside had there were tremendous implications for not just the mental health of these people. Um, I mean, I'll ask you, do you really believe that it's possible for a person to become rational enough to not experience psychological suffering or a sense of moral conflict during war? Um, but there's also the ways that war is conducted and the way that society understands war and the people who fight in it. And once again, this is something I'm trying to put into context with our theme of war and society, and trying to look at this and see um, in this comparison of these two different approaches to war, these Native American people who, would go to battle, were very effective on the battlefield, but as soon as someone's killed, they have to stop and commit to some strict ritual behavior for a long period of time before they're allowed to go back to the battlefield, versus this American, more industrial model, which is every soldier should go kill as many people as they possibly can with the expectation of going home to their civilian lives and not doing anything differently. If that's the model that we're operating on in our society, what does that mean for the way that we experience war, the way that we conduct it, and the way that we understand the behavior and lives of the people that are sent to participate in war on behalf of our respective nations? So I said that I was going to keep this short, so I'm going to go ahead and cut myself off there. I look forward to seeing you all on Friday, and I look forward to reading your midterm papers when we get them in the very near future. Take care.